Well, hello, everyone, and welcome to the Lipedema Patient Roundtable. I'm wearing my beret. I promised I would do it. I wish I had little French Parisian kind of romantic music playing in the background. I have my fluffy pen. It is a night for love, to share love, to encourage each other with love. And we do that every month here at the Roundtable, but it is Valentine's month. And so we are celebrating Galentine's night along with Palentine's night, because for the first time in a long time, we have a gentleman who has joined us as a special guest, Dr. Thomas Wright, who is well known in the lipedema world and one of the authors of the standard of care for lipedema in the United States. Dr. Wright, what a pleasure to have you here.
Well, my pleasure. Good evening to you all.
Yay. We're going to definitely get to talk to you more in depth later on in the program, but we've got to do our introductions as everybody's jumping on. Angie Hampton and Lisa Lugo and Casey's on there. All of our friends are logging on. We're so glad that you're giving us an hour of your night. We invited our regular panelists to bring a +1 if they so chose. So Dr. Herbst, your +1 is Dr. Wright. Would you like to introduce him?
Sure. It's my great pleasure to introduce to you a very good friend, like one of my best friends, Dr. Thomas Wright. We've known each other for years. I believe we met at the FDRS conference. We go to the AVLS conference every year. This last year, we dressed up with cowboy hats and cowboy boots and all adopted accents. He is a research partner, just an amazing colleague. And I think he has even a greater passion for the care of patients with lipedema than I do, which is saying a lot.
That's saying a lot.
Yes. And I mean, we talk about it all the time. We talk often and we text, and it's really all about lipedema. And he runs a practice in the St. Louis area, and he's not only a vascular surgeon, and so he takes care of the veins, but he does liposuction for lipedema.
Wow. Okay, that's quite a resume. And what an introduction. You rocked that, Dr. Herbst. But then again, you rock everything. We adore you, and we're so glad that you're here tonight. If you have any questions for our medical panelists, please do put them in the Q&A, because we would love to address them. We don't offer medical advice, as you know, but when you've got this kind of firepower on the panel, aside from the personal stories and insights from our lipedema patients. So without further ado, I'll tell you about my +1, Jenny Beaujean. Now, when Lympha Press gave me the green light to start the roundtables, it was a little bit of a lonely exercise. And I knew I had made at least 5 friends, our 5 anchors: Pale Ginger Pear, Patty Cornute, Susie Beauchamp, Lippy Butterfly, Cheryl Scoledge. These were my go-to people. Was anybody else out there? I wondered sometimes. And then I got, during a very difficult time in my life, a letter from Jenny Beaujean. And she said that the roundtables made a difference in her life and that she appreciated them. And I don't know about you, but when you feel like you're adding value, that you're not just wasting space in an hour, it lifts your heart up. So Jenny, I had to invite you. And how's it feel to be on the roundtable instead of just visiting the roundtable?
It's already been a lot of fun, and it's just started.
I know. It's amazing. And so I get the honor of introducing another +1, because Susie Beauchamp has a family matter tonight. We send her our good vibes and healing prayers for her mom. We miss you, Susie. But she invited someone who everybody said, we've got to invite this woman of whole and balanced living. Her name is Nita Clewis. Nita, so lovely to have you here.
Hi, everybody.
I don't think you've even ever missed a roundtable.
I've missed a couple live and had to play them back when I was working and covering stories out in the field, like live journalism things. But no, I'm telling you what, we always talk about this. Community is everything. And this panel and what you bring month after month after month, I tell everybody, go to the Lipedema channel on YouTube, watch the replays, go follow Lympha Press, go to the links, sign up for all of them, get your reminders, because it really is top-notch information, and people can get questions answered, and it's marvelous. I mean, it's
And-
such a wonderful community, and we don't feel alone out here.
No, and that is so
Grateful to
true.
be here and learn with you guys, because we always take something away.
Well, we always take something away from you. And I encourage people to follow you at Whole and Balanced Living. And if there are any other places that they need to be following you, and I had a deer in the headlights moment, just remind us. But back when we started this, I didn't even know what a hashtag was or how to use it. So dear Nita was always texting me, you know, Brenda, you really need to tag people in your posts. And thankfully I now have Alexa Ercolano, who is brilliant at all that stuff. And you also told me about how to market the Lympha Press, because, you know, we were trying to educate people that the Lympha Press Optimal Plus was designed with lipedema in mind, and that it is so easy to use for lipedema patients and, you know, the whole spiel. And Nita was like, you just need to show another pump that's sitting in someone's closet because they can't get it on collecting dust. And that's the marketing you need to do. And I'm like, wow, Nita, you're onto something there. We didn't go quite that far with it, but I thank you for being here on the panel. So I'm going to throw to Angelique Charles, who is the Lippy Butterfly, and I want her to introduce her plus one.
My plus one tonight is Angela Jones. You might recognize her from the Lymphedema Roundtables, but she has been an excellent friend, and I think that is so important for us. We talk often about how mental health is really important to the Lippy body, and Angela Jones, she's supposed to be here as my nutritionist. She cannot get herself to stay in Arizona, so she has been a confidant and a friend for me during these last few months, and I just absolutely love her.
Thank you.
How does it feel to be crossing over? It's like one of those Grey's Anatomy Chicago Hope episodes, you know, where we just sort
it's
of
an
cross
interesting
over.
feeling.
It's a little different feeling. There's a whole different vibe really at the Lipedema Roundtable. And I think it begins with the L word. There's just so much love here. And I think, well, speaking of love, Pale Ginger Pear, we love you and we welcome you back from your most recent surgery. Can you give us the Reader's Digest version of it?
We did more in the upper arms because there was some areas I told him that still hurt. We could feel the nodules. So we just did more lipo and manual extraction, no skin removal yet. And then we did the back of the thighs for the first time.
And that created some discomfort when you were flying home.
Yeah, I mean, flying is never fun as a plus size person. The seats just aren't made for us. But then when you have the edge of a seat digging into freshly liposuction thighs for 9 hours, it's not fun.
We feel for you, but here she is, undaunted
On my
at
bed.
Palentine's night. We just love that. And your plus one is someone who's never even visited one of our roundtables before. Why don't you introduce Kelly Lynn?
So Kelly and I met through Instagram a few years ago now, and we are like an hour apart from each other. We're super close and yet super busy, so we never get to actually hang out as much as either one of us would like. But we just connected, and I knew from the minute I saw her that she had lipedema, but
I didn't know.
but I knew she wasn't in the point of her personal journey to hear it. So I kept my mouth shut and just like secretly was like, one day she'll let me tell her the answers. And then she texted me one day and was like, my doctor told me I had lipedema. And I'm like, yeah.
Like, yeah, I know. My doctor did the same thing. Yeah, you have it. Because I was like, is there any chance that maybe it's just like, don't you know? Of course you have it. And I was like, why has no one told me this?
Yeah.
I had no idea.
Wow.
But you knew the whole time. But I think it was really smart and really mature and a good friend to be able to know that, like, not to say anything until I was ready, because that's not something someone can understand until they understand. So I think that was very, very kind of you to do.
I love the sensitivity that we share among the panel. And I think even in your presentation, Mind, Body, and the Matrix, Dr. Herbst, you mentioned that lipedema women also tend to be empaths and very caring toward one another. Isn't that an interesting component?
Yes, that is.
makes them especially lovely to work with. Speaking of especially lovely, how's that for a transition? Cheryl Scoledge is with us, Lipedema Diva, who also runs the amazing Facebook page, Lipedema and Food Sensitivities. By the way, you had a bit of a breakthrough that you were telling me about before we went live. I always ask my panelists, how are you feeling? Because, you know, this is an important question. And you said you were feeling a little bit better. I thought Dr. Herbst and Dr. Wright would be interested in perhaps why and maybe have an opinion about it. Go ahead, Cheryl.
Yeah, sure. There is a eye doctor who believes that dry eye might be a symptom of POTS. And so if we go through the little string of lipedema, EDS, POTS, POTS is postural orthostatic tachycardia syndrome, which basically means that when you stand up, your heart is having a hard time getting all of the blood to pump. So I know all the doctors know that, but just to give a little background. And so people who have very severe POTS syndromes will feel faint. But she thought that dry eye can be caused by POTS, and I have really bad dry eye currently. And so she came out with a supplement to help both POTS symptoms and dry eye. And so I've been taking it for about a month. And I really think that I've started getting a little more energy back. So that's been really exciting. But I also want to introduce my plus one, April Sluder.
April Sluder of?
She is of a lipedema journey and also lovely lipedema ladies. So I want to let all of you know that you need to go find her on Facebook. She also has an Instagram, lovely lipedema ladies on Instagram as well. And she also developed a lipedema journal. And so you can purchase the journal and you can, write down all of your symptoms, what's going on in your life, your thoughts, and she can probably even tell even better than I do, because for some reason I'm a little tongue-tied tonight. I don't know why. So
because we're so excited. That's why.
I know, right?
It's a great night. And I want to tell you, April Sluder, your message of self-acceptance and self-love is resonating with so many people. I feel like it's the seminal journey for everyone, whether you have lipedema or not. It's that self-worth and self-acceptance. So in a nutshell, why did you come up with that messaging? And why was it so important to you?
Well, you know how you mentioned that a lot of lipedema ladies are empaths, and I definitely feel that I am one. It's what led me to becoming a social worker and just having a passion for helping people. And, when I started getting into the lipedema community, I just saw so much pain, and because of my heart, I just felt like, what can I do? How can I help? And I wanted to create a space where women could just feel completely accepted. And so that's what I did. It was kind of just a very organic process. And, I'm just always trying to think of what are the true issues and needs, and what are women struggling with, and how can I support and encourage and point them, in directions that might be helpful to them. And I've met so many amazing people, and I've been actually getting on the phone with a lot of ladies recently. And it has taught me so much that I didn't even realize about the struggles that people are going through, and even given me more passion, for helping.
Yeah. Well, you do a great job of it. In fact, I really enjoy your selfie Sundays. I have not done a selfie yet, because usually on Sunday morning, I look like Phyllis Diller until I've had my coffee and, but I need to embrace myself and in all stages of life. There is some chatter going on about this dry eye supplement. And first, before we even go to it, Dr. Herbst or Dr. Wright, is there any I'm not discounting what you're saying, but it'd be wonderful to hear from them about connecting the dots between this dry eye situation. Anything?
There's a bunch of theories. a lot of people with EDS, for example, or just joint hypermobility also have dry eyes. And Dr. Afrin, who's actually speaking at the FDRS conference in Cleveland in April, thinks that mast cells are one of the causes of lipedema and could be one of the causes of dry eyes. And mast cells are linked to POTS, so it could all just be linked together.
Very interesting. Anything you want to add to that, Dr. Wright?
No, I've just learned, like usual, I'm learning from Karen right now.
Well, I always learn. I just
From
shut up and listen.
Cheryl,
And from Cheryl too.
Cheryl.
Okay, so Cheryl, is that an over-the-counter supplement for dry eye? And what is the name of it? Darlene and Holly and Angie, they all want it. Everybody wants to know.
And I'll also post it in on my Facebook page, Lipedema Diva, and in our sensitivities group also. It's called Parasma Plus. The doctor is Dr. Driscoll, and she's done some clinical trials over the last couple of years and developed the supplement. So the supplement is supposed to help the vagus nerve and the one of the nerves for the eye to develop tears. Ooh, nope, I can't get it. Nope.
That's all right. You got us halfway there. We know how to Google and we can make things happen. So
yeah.
Parasym Plus, right? PARASYM. Is that correct?
Yes.
Okay.
Yes. Yeah. So there's one apparently for POTS specifically, and then there's one that is for POTS and dry eye. So,
excellent.
how about that?
So
Yeah.
I want to pose this question of the entire panel. And if you have an answer or a suggestion, just go like this and I'll call on you. Victoria Bowden, what suggestions do you have for skincare, especially in the winter when everything is so dry? Oh, go ahead, Jenny Beaujean, go for it.
Got on mute. I recently just had a refitting for compression garments, and my fitter, who's Joanne Brooks up in New Hampshire, turned me on to a new product with urea, UREA, but it's a foam mousse moisturizer called Cutimed that actually is able to be used with compression garments. So you don't have to worry, do I have too much moisturizer to put on my garments? And it's fantastic. It goes right in and gets absorbed. And I've just been using it now for about 8 weeks. It's phenomenal. Cutimed.
Cutimed,
So,
you may want to put that in chat, Jenny, just because I know everybody's going to be saying, how do I spell that? Where do I get that? Anybody else want to talk about skincare?
I found it on Amazon.
Got you. Go ahead, Angelique Charles. And then Nita, you're after her.
One of the things that came up for me in the past with skincare was getting rid of perfumey lotions. I had to get rid of all of the bath and body products and keep my pH between, I think 7, like close to 7 or something like that. What I've been doing recently, which I don't know how that works with compression garments, is I use a collagen-based lotion with my African oil, which isn't only for African American people. It can be used for everybody, but I just noticed that there was an excessive amount of dryness with my skin, and keeping those natural oils present on the skin surface just wasn't happening. So adding them back with the African oil has really, really helped me and actually brought back some of the coloration in my skin at this point.
Great advice. Love it. What about you, Nita? You said you had some thoughts on this.
When I was working in the skincare industry, one of the things that we were always taught had to deal with exfoliation with dry skin, right? Because winter, we're all dried out. Humidifiers in your home, right, where you're working, keep a humidifier going. But outside of coconut oil, which we all know we can put coconut oil on, and most people aren't sensitive to that because, as somebody else was saying, we have these fragrance issues and these problems. You can look into like vitamin E oils, some of the creams that are out there that are hemp based, that are just a hemp and a coconut oil combo, have been very nourishing for chronic dry skin, and they don't interact with the fabrics when you're putting on compression or reduction kits. But definitely always start with exfoliation. And I'm getting ready to test out, you might have seen them online, these gloves that are plant-based. And they're kind of akin to a washcloth. After you've soaked, you rub your skin and it's supposed to pull off and exfoliate for you and help to alleviate dry skin symptoms. So when I get those, I'll put them up, and I can't remember the name of them right now, but if you just search, she's out of Canada, Canadian plant-based exfoliating gloves, you'll probably find her like that. And they're supposed to be great. So I hear you about the dry skin. I don't like to put chemicals on. So that's the best bet.
Great advice. Great advice. Anybody else on skincare or anything that our doctors advise? Go ahead, Angela, go for it.
I'm a fan of oils. I like olive oil. I like coconut oil, vitamin E oil, and castor oil. I do dry brushing in the mornings for about 30 minutes, and I follow it with castor oil usually, and I find that that's a good moisturizer for me.
So the dry brushing in advance is a real key to it being truly effective, correct?
For me, it has been. I do it primarily for circulation and to move my lymph early in the morning.
Yeah.
And sometimes I do the same thing at night, but I've found that that combination works for me.
I love the way our panelists are always so careful to say, well, this is what worked for me. Because I think one of the things that we've learned is while we can draw some conclusions and offer some broad suggestions, lipedema is very individual. It may affect you differently than someone else. Something that works for someone, a diet perhaps that works for someone, or an eating plan may not work for someone else. And you need to listen to your body and figure out what works best for you. We always hope, and I have to say this, that Lympha Press is part of your solution to manage your lymphedema and your lipedema. How many people here are using the Lympha Press? Okay, Jenny, since nobody's really heard from you about your Lympha Press, why don't you tell them about ease of use and how it has impacted your lipedema?
Oh, it's so easy to use, you know, quite honestly, and that was part of the reason I went that way. And as you know, I had to really struggle to get it because we don't have a lot of people helping with that here in New England. But I use it every day. I have a lot less pain. I definitely noticed that it's helped with some of the excess fluid to help keep it moving. And I've just started around with my CLT. And she could even tell from the last time a couple of years ago that there's just quite a difference in the sort of condition of my legs. So, you know, it's part of the day. It's easy to use. The 2 zippers, just zip, zip, and off I go. So
I love it. I love it. And by the way, I'm hearing some wonderful comments in the chat too. Thank you so much. And I want to get back to doing my one-on-one interviews with people. You know, I went through some stuff over the last few months and I'm ready to get back into telling your stories. So like Lisa Lugo and Angie Hampton and all you wonderful people out there that are using your Lympha Press, email me, bviola@lymphapress.com. I'd love to schedule a one-on-one interview with you because why? Because it encourages people. People need hope, and that's part of why we do these roundtables every month. There's a lot of medical questions in the Q&A, so I'm going to throw some out to the doctors. How about, can Dr. Herbst speak to the use of, or Dr. Wright, the use of Mucinex or herbal lymphatic drainage for lipedema therapy?
I am going to let Dr. Wright answer.
Oh, really? You know, it was interesting because I was, I want to talk about Mucinex first, or wafenicin, so my understanding is it helps with, I mean, there's a lot of things this wafenicin does, but we think, or at least my understanding, and please, I'm open to learn more, is that it helps with the coagulation of the proteins in the lipedema. And I'm not clear on the mechanism, but I mean, I know I have a lot. So this is what I I know it's helped a lot of ladies. They also report that they have to pee more after taking it. And so that's where I am with that knowledge. I'm going to throw that back to Karen.
I think that's absolutely true. When I looked up the mechanism of Mucinex, it was unknown. And they did talk a little bit about like ciliary clearance, but I really do think it loosens up that mucus that's in between the cells and the tissue. So like it helps loosen the mucus in your chest. It does the same thing in your tissue. Some women respond to it and some women don't notice a difference. And I would love to know why that is, why some women notice a difference and why some don't. And then some of the other herbal remedies, like dandelion root and others, they actually seem to work. They have a little bit of a diuretic effect, and I don't really know exactly why that happens, but they do help to relieve some of the congestion in the tissue. So I think if it works for you and you don't have any side effects, and it's okay with your healthcare providers, why not?
Why not? I love it. Great advice. Go ahead, Pale Ginger Pear.
So for like 2 months solid, I had sinus infection stuff going on. So I was taking Mucinex like nonstop. And my thighs, like the front of my thighs, got empty. Like you could see the results of like when I had first come out of surgery from the thighs. But I don't like taking it daily. I don't like taking any medicine daily, really. I'm kind of like avoid chemicals if possible. But I also don't like the smell that it can give you. It gives you a very strong, almost like a flea collar kind of smell.
Ooh.
Yeah,
the
so
flea
it's
collar.
not something that I want to take daily, but I did notice a difference when I took it like for 2 months straight. Now, like when I would take it for like a week when I was sick, but when I had like 2 months of almost a solid sinus infection and I was taking it, I noticed a difference, but it's not something I would take, me personally would take nonstop, and it can get expensive for taking it like daily.
Gotcha. Okay. Well, that's good. Yeah. Go ahead, Cheryl.
There is a over-the-counter brand. So in the US, if you go to like a CVS, if you take a look, it's called like sinus congestion, like is the name of it. But if you actually look at the bottle, it'll say guafenicin on it. And so that tends to be a less expensive brand. And you want to make sure that you get the one that does not have the decongestant in it.
The one that does not have the decongestant in it. Excellent.
Yeah. So
Good.
just the straight guafenicin.
Good. Thank you for everybody weighing in on that. So blood pressure monitors. Amanda would like to know, Dr. Herbst, is there an update on blood pressure monitors that won't squeeze the tissues? She remembers you talking about this last year. She's been looking to no avail.
I just looked that up yesterday, and I saw some finger monitors, but I didn't see one that I could purchase, unfortunately. So we're still using a wrist cuff, but even then, if you have a lipedema cuff, squeezing that isn't exactly the best idea either. So unfortunately, we're not quite there yet with the finger cuffs.
Gotcha.
But I mean, you can get a watch with your blood pressure, but I don't know. I guess if your healthcare provider isn't going to do anything with your blood pressure, they're not going to change your medication in any way, shape, or form, and you've already had your blood pressure measured recently in a different office, you can respectfully decline.
And Pale Ginger Pear, were you going to say something about that?
Yeah, so I just had issues with my blood pressure reading to get cleared for surgery. My local doctor wouldn't listen to me and kept trying to do, well, his staff wouldn't listen, the doctor itself, but they wouldn't listen, and they kept trying to do the blood pressure on the upper arm with a smaller, like regular size cuff. And I'm like, you need to go larger cuff and you need to go on my forearm. And they kept arguing and they couldn't get a high read. So they put me on like a blood pressure medicine and tried to like bring me back a few days later before they would clear me for surgery. And then even out at Dr. Jamie's office, they had a hard time getting the machine to read even on my lower arm. We ended up taking my blood pressure on my right ankle.
Really?
Yeah.
Interesting. You know, you mentioned your doctor wouldn't listen to you. And that I want to go back to what Dr. Herbst said at the beginning. Rejection of the chronically ill woman is more common. Chronically ill is more common among women, which is really, ooh, makes me see red. And I'm not just talking about my beret. This article that Dr. Herbst sent to me, and I sent it to our regular panelists, is from Catharina Melander, Women's Experiences of Living with Lipedema. And the conclusion was this: having one's pain and suffering recognized and confirmed is vital, since this creates a power that makes it bearable. I thought that was a really profound ending to that article. And if you registered for tonight's roundtable with our post-show email that we always send, we'll also send you a copy of that very interesting article, Dr. Herbst, and I want to thank you for sending it my way. And you said it just really can confirm and affirm to the lipedema population that they're not crazy. You're not alone.
Absolutely. And they just have some nice stories in there. And they touched on so many different things, including, sexuality in women with lipedema. And I thought that was really nice and well done.
So I want to say thank you also to Dr. Wright, because sadly, what I hear more often than not is I can't find someone that will diagnose me. I can't find someone that will treat me. And we are so grateful for the medical professionals who have devoted themselves to the study of lipedema and to help women with lipedema. Dr. Wright, how did you become interested in this and trying to help provide management solutions?
Well, so my grandmother had lipedema, but it wasn't diagnosed as lipedema. And she had, classic, type 3 legs with the cuffs, and they were always sore, and she had a lot of troubles with it. And, but of course I loved my grandmother, and she, I knew that was something that, there was a real need, and when I learned of lipedema, and it kind of hit me, and I kind of, I kind of appreciated that this was something. She always just called it her German legs, and so I wanted to be of use, and I felt like this was, I knew that there was a lot of unmet need there.
Well, you are of use, and we're glad you're our Palentine tonight, Dr. Wright. It's an absolute pleasure. Kelly, this is your first time at the roundtable. So I want to know what your thoughts are. Do you have a question that you've always wanted to ask other lipedema women or medical professionals? This is your big chance.
So in these 30 minutes, I have learned more in these 30 minutes than I have in the last year. And I almost cried like 10 times. So I appreciate that, but don't want to do that. But
it's not a good roundtable unless someone cries.
Yeah, there's so many things everyone's talking about that I've just been dealing with on my own, like the dry skin. And since I found out I had lipedema, she was like, I don't know what to do. After she was like, of course you do. I don't know where do you go after this. Here's some names. I have called so many doctors in and around me that are just like, I can't help you. And no one wants to help me anywhere local. I upped my insurance. I've tried. I don't know what to do. And I feel a bit lost. And I'm like, I'm Googling, but yet getting nowhere. And there's so many other things. I've been thinking for a long time, I think I have EDS, but does that go inside? I also have fibro, but do I really? I also have degenerative disc disease. Do I really? It's all these things. I just don't know. And I have no one to talk to because my primary, she's wonderful, but it's like I'm at this roadblock and I don't know how to blast through and where to go. And I just feel lost. And like, in 30 minutes, I just learned more than I have in a year. And that makes me sad because I have so many people that follow me and my Instagram, and like, I want to help them, but I can't help people if I don't even know. And I don't have any, I just got my first pair of compression pants that I bought on Amazon because I didn't know what to do. So I just bought a pair, and the feeling after 10 minutes, I was like, what is this sorcery?
Wow.
And I just feel like I've been living in like a hole, and I'm trying to learn more. And thank God I have Kara. It's like, and I'm finding more people and more information, but in just 30 minutes, I learned more than any doctor has ever told me. And now I'm like, well, now I'm gonna have to check in every single month now.
Well, you're just gonna have to. We want you to.
I feel like a baby, like an infant in all of this. And it makes me sad because I'm such an advocate for people fighting for their rights in medical, because I know how I've been treated, and, you know, as a supersized person, and like, I fight for those people, and I need to fight for myself. And thank you, Kara, because Kara's, you know, really lent a very big hand in that. And thank all of you, because I learned so much in 30 minutes, and my mind is like, so I'm just sitting here like, because I didn't even know this stuff.
All right, so now we can see why Pale Ginger Pear loves you so much. You are delightful, and we're, you know, it's never too late. This is the good news, everybody. It's never too late. Today is a brand new day.
I want it all. I want all the information, so then I can spread it. That's what I want to use my platform for, is to be able to help other people, right? That's what we do. And lipedema people, that is what we do. We all want to help each other, but I really don't know. So if there's anybody that could give me a suggestion of where I could look to find a doctor that could help me, and I'm not even looking to necessarily get the liposuction surgery. I would maybe eventually, sure, but just to start managing the pain, the diseases, the treatment. I have a lot to live for and a lot to do. And I'm a very active person, a naturalist. So it's like, I want to do more and more and more. And lipedema, I already felt like it took a lot from me, and I want to be able to manage it so I can do more. But I need to know where to go next, like doctors.
Drop the mic. That was awesome. So where to go next? First of all, where are you located?
Ohio.
Okay. Ohio.
She needs a Lympha Press.
You bet. You need a Lympha Press.
I don't know what that is.
Are you? What's a Lympha Press? Oh my
I'm so sorry. I don't even know. Is that the thing
I could kiss you.
Yeah.
Kelly Lynn. Yeah. You asked my favorite question of the whole entire night. What's a Lympha Press? A Lympha Press is a pneumatic compression pump. Now, you said how much you loved your compression pants, right? Okay, so the pump blows air sequentially. It's like wearing ski boots, only the pants go up right underneath your chest, cover your whole abdomen, your hips, your
fancy pants.
The fancy pants, right?
Oh.
And they're easy. You just zip them up, push a button, boom, and you are getting a really wonderful massage therapy. Dr. Herbst, you can explain it much better than I just did. But first of all, what part of Ohio are you located?
Northeast Ohio. So they're Kent State University, like Kent, Akron, Cleveland. Like
okay, Cleveland. Oh my goodness. And you're near
she used to come to the RDS conference.
Oh, yeah. Oh, yeah.
By the way, first of all, I mean, there's so much energy going on here. We will, Kelly, I'm going to connect you with your local Lympha Press representative in the Cleveland area. Her name is Deborah Springer. She is a rock star, and she will make sure you get taken care of. And she will connect you with doctors in that area that can serve you well.
That would be
That's
great.
the important thing.
Why is it so hard to find? I just don't understand. Like, why? That's not fair. And there's so many people that don't even know they have it and they can't get help. And it's like, it makes me so upset because, and I'm a person, I'm out there and I will look hard and I can't find it. And I'm just like, it feels very alone. It feels very scary.
Well, one of my favorite things to hear, and I will go to you next, Dr. Herbst, is that which you are seeking is also seeking you. How's that for a little dropping some woo woo? But still, I believe if you're seeking, it's going to find you. And guess what? It found you tonight, Kelly Lynn. And we're excited about helping you. So Dr. Herbst, jump on in.
So a patient of mine, her name is Sandra Tier. She developed a website called lipedemasource.com. And you can look up providers on there. So that'll be physicians, other healthcare providers, and physical therapists. It's actually very well done. And on the front page is Tom Wright.
Whoa, all right. Love that. You're getting a lot of love tonight, Dr. Wright. And also,
She's right by the Cleveland Clinic. I mean, there's a lot of good doctors up there. I mean, and so please.
yes. And also in chat, thank you, Casey, noted that the Lipedema Foundation has a listing of lipedema specialists available. You can grab that link that's in chat right now. And everybody's abuzz about two things right now. One, the fact that the amazing Patty Cornute joined us tonight because she wasn't sure she could because her beautiful daughter just turned 18 years old and she appropriately wanted to spend the evening and celebrate with her. But we're like, if you could just even make a special guest appearance, Patty, because you certainly are our Palentine. You have been here from the very beginning of the roundtable. How are you feeling jumping in? What are you feeling the energy?
Oh, yeah.
It's a great place to be. And the other thing we're all excited about, aside from Patty being here, is the FDRS Fat Resource Society conference that's coming up in April. And guess, all right, raise your hand if you're going to be there live and in person. All these people, and Dr. Herbst is the keynote speaker. And we are going to be there together. I sort of have been trying to see if we could do a live roundtable, but whatever, we're going to all be together and encourage each other, and it's going to be wonderful. So if you want any information about the FDRS, so I was talking to Dr. Herbst about it because, as you know, she is Lympha Press's new medical director. I know I had to say that at least once in the evening, right? But I'm talking to her about it. She's like, yes, well, I started the FDRS, which I felt like an idiot for even asking.
Well, I did start it with two other patients, Sue Grimshaw and Susan Smith. And really, Sue Grimshaw took the reins of it and really made it happen. So, and basically Susan and Sue sat me down and said, what do you need us to do? What could we do for you? And I said, we really need a society where we can all get together and learn and educate each other. And there we are.
And there we are. And so Sandy Darley just put in chat, we're going to have a lot of extension cords and plugs so everybody can plug in their Lympha Press. We should have a pumping party. Right? This just came to me. We should have a pumping party. Lympha Press is going to have a substantial booth there. We'll have some zero gravity chairs. If you've never tried the Lympha Press, it's going to be a great opportunity for you to try it, or bring your BYOP, bring your own pump, as long as it's a Lympha Press, of course. And so Sandy is so clever. She said, we'll call it Meet the Press. Man, you people are just, you're so good. I better watch my back because you'll be hosting this webinar soon. All right, a few other questions from the audience. What is the relationship between pelvic congestion and lipedema? How do you find out if you have this? And what is the solution? There are several questions packed into here, Jennifer Lyons, and we appreciate it. Her vascular surgeon mentioned this relationship between pelvic congestion and lipedema. Any thoughts on that from our medical panelists?
I'm going to give this over to my Palentine guest, Dr. Tom Wright, who's a vascular surgeon.
Yeah, so there is so all venous varicose syndromes, including pelvic congestion syndrome, are associated with EDS and lipedema, and there's increased prevalences of both. And that to me is the only thing I'm quite certain of. And pelvic congestion syndrome can be quite problematic.
Mm-hmm. So we have another question from Tahila Malad. Dr. Herbst, can you let us know if a Theragun can be used on the abdomen to try and break up nodules, specifically on the abdomen, or will it exacerbate the condition?
I don't think it will exacerbate the condition. I think you can use the Theragun or whatever muscle massage gun that you have anywhere on your body, as long as it doesn't cause you problems, as long as it doesn't cause you harm. Sometimes there's a pain where it's painful, but it feels so good. And then there's a pain where your body tells you, I wouldn't do that there. So if, depending on how you feel, I would take it easy the first time that you did it and see what the outcome was. And if you got good results, then you could increase over time.
Great advice. By the way, go ahead, Patty. Patty, jump in there, my galentine.
I use those massagers and I have a couple of different versions. The one that's the gun style is really powerful. So if you notice it's too strong, you can kind of just angle it a little bit and have less direct pressure. So that works for me if I angle it a little bit. Otherwise, it's a little too strong.
Good point. And
I think you could also wear compression too, especially if your belly fat is kind of loose. It's hard to kind of get at it with a gum, but if you held it together using compression, then you could kind of focus your treatments a little bit better.
Oh, that's a good idea.
Good point. Victoria Bowden wanted to know if there is a standard treatment time in the Optimal Plus. And we always say, listen to what your doctor has prescribed for you. Generally, it's an hour session at a time that's convenient for you in the comfort of your home. Some people do it in the morning first thing, or they'll do it at night when they're watching TV. There are some people that have done multiple hours. Their bodies have not disliked it. Kelly Maynard was using her Optimal Plus on upper and lower extremity for up to 5 and 6 hours a day, not continuously. Go ahead, Cheryl. Did you want to add something?
I just know Kelly and I have talked quite a bit about it, and yeah, she'll do 5 to 6 hours. So she'll do I think legs and arms in the morning. I think legs at around lunchtime, and then again at night. She'll jump back in again.
Yeah. The one thing is, if you have been prescribed pneumatic compression therapy, follow through. It's just like a gym membership. You can have the best equipment in the world, and if you don't use it, it's not going to work. That's why it's so important that it must be easy to use, because if it's easy to use, then you will zip it up, relax, play Wordle. How many of you are playing Wordle out there? Oh, good. I'm glad I'm not the only one. I'm not the only one. We are running out of time. So I want to give some of our friends and our guests a chance to say a few parting thoughts of encouragement to the lipedema population as our Valentine, Galentine love letter to all of you who took the time to join us tonight. So April, why don't you take a moment and offer some love to our audience and your fellow panelists tonight?
Thank you. And I want to thank you for letting me be here tonight. It's been a lot of fun. I'm inspired by all of you, so it's really cool to be here. I think what I would say is that it's very easy to get overwhelmed by all of this. And when you see people talking about all of the things that they're doing to manage their lipedema, it's easy to, get so overwhelmed that you do nothing. And I've talked to some ladies who are kind of in a dark place because it all feels so very overwhelming. And what I would stress is that, the best way to pull yourself out of those dark places is to get into some sort of action. So even the smallest little thing, if you can just say, I'm going to do that thing every day for me, because I'm worth it. And it's not an all or nothing thing. We're all different. We're all on a different journey. What works for me may not work for you. And we kind of have to experiment and play around and try different things and be wary of not letting yourself get overwhelmed with all of it, and just take some sort of action every day to take care of you. And, just do that and you're going to be okay.
Wow,
and reach out. This community is so important. Kelly Lynn, so many people can relate to what you have said. I live in Cincinnati, and when I found out about lipedema, I thought, yeah, no problem. I'll find a doctor. No, I had to go to OSU and Dr. Dean, but I just want to say that I'm getting too chatty, but I love this community. Thank you.
Well, we love you back. We love you back. And we're so glad that you are a special Galentine tonight. Angela Jones, you're visiting the panel. So I want to give you the floor, and you always have something to uplift my heart. And so take it away.
I want to thank Angelique again for inviting me. One thing I realized over the past week, we all have a disease that's customized to us. So as April was saying, whatever worked for one may not work for another, and we can't beat ourselves up when we, attempt to adapt what someone else is doing. And also, almost every day, you may realize that your protocol has to change. Your care has to change. What worked yesterday for you may not work today for you. So you have to be willing to accept that it is a disorder, a disease that I often refer to mine as something that plays around with me, because I get really, really comfortable and I find a protocol and I think, oh boy, this is it. And it's not it continuously. So just realize that be able to adapt to the changes that it will give to you. Thank you.
Mm-hmm. Well said. Thank you, Angela. Beautiful. And I see Nita Clewis nodding so much. Your head might pop off. So Nita, take the floor. We want to hear from you.
I just resonate so much with what others have said, because it's sometimes we hear the analogy of whack-a-mole dealing with lipedema, and what comorbidity, what symptom, what's going to come up next. And I've been there. I've been in those places where you feel overwhelmed. We still go there. I mean, you just never know what adversity is going to come. I'm looking so forward to Patty's, the next big, lipedema mini triathlon for awareness and doing what we can do, and modifying for us, because it's about activity and the inspiration that she brings her community every day. Cheryl brings so much inspiration to her community and the wisdom, and having the Lipedema University. I mean, there's so many movers and shakers in this community. When I first came to Instagram and started talking about lipedema openly, Kara was one of the first people I bonded with, because she did not care. And she was like, this is me, love me or hate me, this is me. And to think back through all the years of building relationships and friendships and meeting people, as we know, all over the globe, right? There's one thing: you will always find community within these people here and within their communities and their groups and what they're doing out there on social media. And you don't have to feel alone, and you don't have to feel overwhelmed. And as everybody says, just do a little something every day, and don't be afraid to fail. Don't be afraid to have a bad day. And ultimately, since we're talking about love, and it's all about self-love right now, and I see it recurring time and time again, where there's so much negative self-talk and self-hate on us for what we've been through that's been beyond our control. Please give yourself some grace. Please give yourself some love. And if you wouldn't say it to your best friend or your lover or your child, please don't say it to yourself, because you're worthy of the same love you're giving everybody else. Please give it to yourself.
Anita, thank you for sharing that. Love you. Thank you so much. That was so beautiful. Man, I remember every time I would get a text from Nita, I'd be like, oh, what have I done wrong now? Because she was always, no, and I mean that in a good way, because I was always messing something up on social media. But it's just so beautiful how some divine thread has linked all of our hearts together. And here we are now. It's actually a really special night. Before I go to you, Jenny, because you're my plus one, and give you the floor, I do want to acknowledge this beautiful girl next to you, Patty Cornute. Oh my goodness. This is, tell us who this beautiful girl is, Patty.
This is my daughter, Noelle, and she turned 18 years old today. And he is my Galentine every day of the year.
Well, if it was possible to, well, actually, only Angelique is allowed to sing at this roundtable because she is really, really good. But we will say, happy birthday to you.
Thank you.
Thank you for sharing your mom with us at the roundtable every month.
It was
We
a
really
pleasure.
appreciate you. Awesome. All right, Jenny Beaujean.
Oh, there is so much to be said. But a shout out to everybody here, because since I got diagnosed 3 years ago, though I have had this all my life, small changes, little bit at a time, added in from all of you, Dr. Herbst, Cheryl, Patty, I got push-ups down. They are now part of my life. Counter push-ups every morning with my coffee.
Nice.
It has made all of these little changes in the past 3 years have made a monumental improvement to my mobility and my feeling of well-being, conservative measures. You know, my goal is to not progress further than late stage, go figure. But all of you, and I can't tell you, Dr. Herbst, how many times on Facebook I keep passing around your standards of care when people come on and say, I just got diagnosed, I don't know what to do. The standards of care document is a great place to start, to just get information, reading all the topic sections on all of your pages. You know, I probably spent 6 months. We've had it for a lifetime. Don't try to do everything all at once, as other people said. Take it in little bits because it can be so overwhelming. But a shout out to everybody, because it makes all of your efforts is widening the scope. And even in 3 years, I think the awareness around lipedema has changed so dramatically. So thank you all.
Absolutely. Yes. And I'm so glad you mentioned the standard of care. You know what? We're going to also put that in the email again to everybody. It's also on the Lympha Press website. By the way, we got a brand new website. I've been working day and night to get it done, and it's done. So you need to go to lymphapress.com and you'll see Angela Jones right on the homepage, zipping up her Lympha pants. It's awesome. Kelly Lynn, final thoughts, and then I'm going to go to you, Dr. Wright, since you joined us tonight as our Palentine. Go ahead, Kelly Lynn.
Yeah, huge thank you, especially to my sweet little Kara baby right there, my little fellow ginger little baby. And thank you to all of you for showing me things I didn't know. I'm super glad I learned all this. This is going to be a monthly thing. I'm going to come back and check out you guys and learn more. I've learned so much, super appreciative. But something I always say all the time is, it doesn't matter what our weight, our health, or our ability is, we are still worthy of love, happiness, and respect, no matter who we are at all times. It never changes. No matter what we are now, then in the future, we're still all worthy of all those things. So
there's are you getting it out there? There is a common theme happening here tonight, and it is all about love. So Dr. Wright, this is your first roundtable. What do you think? Aren't we awesome? But you're muted.
Sorry. Thank you. This was wonderful. I really, it was wonderful and I learned a lot. And thank you for including me tonight.
Oh, well, we would love to have you back. And Lympha Press wants to do a webinar with you in the future. So I will be in touch, Dr. Wright.
Thank you.
Regular panelists, any final words? Angelique?
I am still on this thing of dating yourself. Self-care takes so much time. We've learned so many different things that we need to do to take care of our lippy bodies. And sometimes you can feel really guilty with taking that time out of your schedule. We're juggling so many different things. Set aside the time to date yourself, whether you have someone or you don't have someone. You need to be whole in order to care for the people who are around you. So take the time and love on your lippy body.
Amen. And Kara Cruz, thanks for being here after surgery. We know it took a lot, but you're so special to us.
Well, thank you. And I was reminded of this with all of the flying that I did this last week. It's just like I say, you have to take care of yourself first. Like if the mask drops from the airplane, you put it on before you help the kids. Push aside the mom guilt and fix your issues, lipedema wise, whatever other reason wise, so that you can be around long term for them. They would rather have you around than have that vacation or that toy they would want you long-term.
Well said. Patty Cornu, we've got 1 minute left. Patty, and then Cheryl, and then we close it out. Go ahead.
I always say start where you're at, 5 minutes, 10 minutes, 10 push-ups, any activity that you can do, any self-care that you can do. It can get overwhelming, but little things throughout the day really do make a difference.
Perfect. Cheryl.
Well, I know we don't have much time, so I just want to wish everyone out there inner peace. There's so much that we can be doing for ourselves, so do not get overwhelmed and just take a moment, relax, meditate, find that inner peace.
Beautiful.
Love y'all.
Dr. Herbst, I didn't give you a chance. Did you want to say something? We'll see you at FDRS, and you are our medical director, and you'll be seeing Ask Dr. Herbst posts on social media soon, so you can participate. And I will end with this. Having one's pain and suffering recognized and confirmed is vital. This creates a power that makes it bearable. I hope that tonight, by you joining us, that your pain is bearable and that you know you are valued and loved. Happy Valentine's month, everyone. We'll see you next month at the round table. Bye.
Bye.